So the next procedure I'd like to go over with you is axillary temperature. Axillary temperature is taken in the resident's armpit. So before we take an axillary temperature, there's two things we have to check about the resident. We do take their axillary temperature, particularly if they're confused or combative. So make sure you do those initial steps. Ask the nurse about your resident's needs, abilities, and limitations. Knock on the door, request permission. Call them by the name they prefer, identify yourself by name and title, explain everything you're doing. Find and gather your supplies. For an axillary temperature, I'm going to have my thermometer and a towel. Close the hanging curtains, drapes, and doors. I'm going to wash my hands, wear gloves when dealing with body fluids, and I'm going to use good body mechanics. So to take a resident's axillary temperature, remove their arm from the sleeve of the gown. You want to make sure you keep the chest area covered. Wipe the armpit and ensure it is dry. That's how we're going to get an accurate reading. So dry the armpit. Depending on the kind of thermometer you have, you're going to put a covering over the probe. For this one, we just kind of push down on the bottom of the box until we feel that little click. Going to place the thermometer in the center of their armpit and fold their arm over their chest. So it goes in the center, and then we fold the arm over. You're going to leave this in place until the signal is heard indicating the temperature's been obtained. So when the thermometer beeps, remove it. Document it. Remove the probe. Put the resident's arm back into the sleeve of the gown. Report unusual findings to your nurse. The normal temperature range for the axillary is 96.6 to 98.6. And then you do your final steps. A, alignment, check to see if they're comfortable. B, bed down in the lowest position, side rails as appropriate. C, make sure they have their call light and water. D, ask them if they need anything before you leave the room. E, everybody deserves a thank you, so thank the resident. F and G, find and gather your supplies, clean them to company or facility policy. H, ask them how they want them hanging curtains, open or closed. And then I your way out of the room. I'm going to wash my hands, I'm going to do a visual safety check, I'm going to report unusual findings to my nurse, and I'm going to document. Thank you.